Hello, everyone. A pleasant day and welcome to the second part of the nervous system lecture. We'll talk about the spinal cord and the spinal nerves. So the spinal cord structure is protected and has coverings. So what are these structures? So change the pointer. Okay, it's protected by the bones, the vertebrae, the different vertebrae, and then the spinal meninges. What are these meninges? Three layers of connective tissue. They are named as the dura mater, arachnoid mater, and the pia mater. These are the three layers of the meninges. Dura is the most superficial, then pia mater is the innermost, and in between the dura and the pia mater would be your arachnoid mater. So these meninges are continuous with the cranial meninges because we're talking about the covering the meninges of the spinal cord, and the spinal cord meninges, the covering, the layers that protect the spinal cord are continuous with the meninges that cover also the brain. So we'll talk about more about the cerebrospinal fluid that is located in the subarachnoid space. So let's get oriented with the picture. This is a cervical vertebra. As you could notice, it's bifid. The spinous process is bifid. So, and then it has also a transverse foramen, the transverse process. So this is the spinal cord. This is a cross section. So these are the three meninges, the dura, then the arachnoid matter, and then you have your pia mater that is really closely associated with the spinal cord itself. So there's a fat in the epidural space here, and then the subarachnoid space here, the one in blue, okay, has the cerebrospinal fluid or siesta. And we'll talk more about the anterior posterior nerve roots, the spinal cord, and etc. Okay. So review, the vertebral body corresponds to the anterior part of the vertebra. The spinous process corresponds to the posterior part. Okay, let's talk about the different meninges and the spaces. Epidural space. Epi means above. So it's between the vertebrae and the dura mater. So let's get oriented with this one. Particularly, this is for the brain, okay, not the spine. Okay, this is the cerebral cortex, but this is also same with the spine. Okay, maybe I should have used a different picture. Okay, epidural space, it's the space above the dura. Okay, so this is the epidural space above the dura. So it's in between the vertebrae and the dura mater, in between the dura and the vertebrae. Okay, epidural space, it is composed of fat in this picture. The dura mater means tough mother because it's really tough. It's a thick, strong layer, dense, irregular connective tissue makes up your dura mater, and it extends to the vertebra, the second sacral vertebra beyond the spinal cord. No, so it does not also end with the spinal cord, but it extends beyond the spinal cord, the dura mater. Then below the dura mater would be your subdural space. Subdural space, it contains the it's just a little bit of interstitial fluid. The next would be your arachnoid mater, which resembles spider's web. It's a thin avascular covering. Avascular means no arteries. Okay, so a vascular covering of loosely arranged collagen and elastic fibers that resembles the spider's web, and it extends into the subarachnoid space. So the subarachnoid space is the space below your arachnoid mater. Sub means below. Subarachnoid space where your cerebrospinal fluid circulates. And then the last but not the least, of the meninges would be your pia mater. It's a thin, delicate layer, adheres to the surface spinal cord and the brain, like in this picture. Okay, contains blood vessels. So this is for the skull. Okay, you have your scalp, the skull, then you have your dura mater. Epidural space would be this space here. Okay, and then you have your dura mater, arachnoid matter, subarachnoid space, and then you have your pia mater that will closely surface the spinal cord, or in this picture, the brain, cerebral cortex, part of the cerebrum. Okay, the singular form of meninges would be your meninx. Okay. So the denticulate ligament is thickenings of the pia mater. So pia mater and fused with the arachnoid and the dura mater, the denticulate ligaments. It's located between the anterior and posterior nerve roots of the spinal nerves. So let's get oriented with this picture. So this is the spinal cord. So you have here your denticulate ligament over here. What are your denticulate ligaments? Thickenings of the pia mater. So the innermost layer that closely is associated with the spinal cord itself, so thickenings. It fuses with the arachnoid and dura mater. And what's the function of your denticulate ligament? It suspends the spinal cord at the middle. You want the spinal cord to be at the middle of the spinal canal. Okay, you want it not to rub. You want your spinal cord not to rub with the inner lining of your uh, with your bone. Okay, so as to protect it from damage. So here in this picture, your denticulate ligaments are this one. Okay, so it's like uh, it suspends the spinal cord at the center. Okay, it's located between the anterior and the posterior nerve roots of the spinal nerves. This is the posterior nerve root. This is anterior nerve root. In between, they are found in between the nerve roots. So your denticulate ligaments protect the spinal cord from sudden displacement. They maintain the position of the spinal cord. So they protect it from sudden displacement that could lead to shock. Okay, especially when there is sudden sudden abrupt and really big impact to the spinal column canal, especially in vehicular accidents. So I want you to appreciate the vessels here that are located near the spinal cord. Then pia mater, arachnoid mater, and the dura mater, most super, most superficial. So mnemonic for your meninges, the AP, dura mater, arachnoid mater, then pia mater. Epi means above, epidural means just above the dura, subdura below the dura, subarachnoid below the arachnoid. Where your cerebrospinal fluid is located, subarachnoid space. So it's like SAS, subarachnoid space, CSF, SAS, CSF. Okay, what is spinal tap? It's a spinal tap, it's a lumbar puncture. So this is a procedure wherein we use a long hollow needle inserted into the subarachnoid space. So we position the patient like a shrimp position, or wherein the patient is positioned in a left lateral position, lies on his or her left side, and then the patient, we position the patient in a way that as much as possible that the patient could do. We position the knees near the chest so that the spaces in between the spinous processes, interspinous spaces, would spread, okay, because of the flexion that happens. Okay, so that we could insert the needle towards the needle up to the subarachnoid space where your cerebrospinal fluid is collected. So the spinal cord ends at the superior border of your second lumbar. Okay, so let's get oriented with the picture. Okay, so this is your spinal column. Okay, you have your lumbar vertebrae here, L1, L2. So at the superior border of your L2, your spinal cord ends. This is your spinal cord. Your spinal cord ends at the superior border of your L2. This is for adults. Okay. Spinal meninges extend to S2. Spinal meninges, meaning your dura, arachnoid, and pia mater, extend to your S2. And between, so having said that, that the spinal cord ends only at L2, and then your spinal meninges extend to your S2. So meaning to say your from L2 to S2, there would be spinal meninges present, but no spinal cord is located there because it ends at the superior border of your L2. Okay, so merong spinal meninges here and there's no spinal cord. That's dahil nag-enda dito. Okay, so in adults, we insert the needle. It's safe access to the subarachnoid space at L3 to L4 or L4 to L5. Okay, so at this area over here. And we usually use, especially anesthesiologists, they look for the posterior superior iliac crest, no, the iliac crest. This is the ilium, IUM, right? Part of your pelvic bone, ilium. The superior border of your crest corresponds to the somehow close to the area that is relatively safe for the insertion of the needle. Okay, so L4 to L5. Okay, so here supracrystalline passes L4 spinous process, but in this picture, uh, it does not follow that. So in between L4 to L5, so in between here, this is or L3, L4, that's a safe position or level that we could insert the needle so that the needle could reach the subarachnoid space so that we could collect cerebrospinal fluid. Why do we do this in the hospital? This is for assessment whether if the patient has an infection that is associated or ongoing in the central nervous system. Okay, cellular changes will happen in the cerebrospinal fluid once there is infection. So we would like to try to assess. So it's a big diagnostic procedure. It helps us in the diagnosis and knows what is the condition of the patient. Okay, so here is a transverse section of the spinal cord within a cervical vertebra. So let's get oriented with the picture. This is the spinous process posterior. This is the anterior. Okay, so you have here the spinal cord. Okay, so this is the dura mater and arachnoid mater because this is not fresh. Okay, so close na sila with one another. And then you have your roots here, the posterior root, the anterior root, and what's located in between the posterior and anterior root, that is the thickening of your pia mater, your denticulate ligament, okay, which suspends your spinal cord at the center. Okay, so you have your subarachnoid space here. Okay, this is your epidural space sa taas ng epidura, sa taas ng dura. And then, okay, so you have here a cervical vertebra pa rin. You have your transverse foramen, which is a unique characteristic of the cervical vertebra. Okay, so you have your spinal nerve, which we will know later that the spinal nerve is the combination already, the meeting of your motor and your sensory nerve roots. Okay. So let's proceed with the external anatomy of the spinal cord. So your spinal cord is roughly oval, as you have observed here. Spinal cord is roughly oval. And in adults, extend from the medulla, which is the lowermost part of the brain stem of the brain, to your L2 superior border. So your medulla oblongata here extends as the spinal cord up to the superior border of your L2. So this is the posterior view. So this is your spinal cord from the medulla oblongata, which is the lowermost part of your brainstem, extends downward up to your superior border of your L2. Okay, your border of your L2. In newborn, it extends up to your L3 or L4. No, L2, L3 or L4. Certain enlargements are located in the cervical and lumbar regions. Cervical, C4 to T1. Okay, C4 to T1. So this is your cervical enlargement for your lumbar regions T9 to T12. Now, T9 to T12 would be your lumbar enlargement. Okay, lumbar enlargement. Okay, because it could extend up to the lumbar area. Your conus medullaris is the tapering of your spinal cord. Where your spinal cord ends, it will taper and then it will form like a conical structure, mukhang cone. Okay, parang cone na siya dito. That's why we call it your conus medullaris. Okay, so your spinal cord ends as a tapering conical structure at L1 to L2 intervertebral disc. Okay, L1 and L2 intervertebral disc. And your phylum terminale arise from your conus medullaris, phylum terminale, which arise, okay, extension of the pia mater that fuses with the arachnoid and dura mater and it anchors the spinal cord to your coccyx. Okay, so let's get oriented with the picture. Your phylum terminale would be the extension of your pia mater that fuses with the arachnoid and the dura mater. Okay, connecting this one to your coccyx. Okay, phylum terminale. This is your sacrum. This is your coccyx. This is your pelvic bone. So extension of your pia mater up to your coccyx that fuses with extension of the pia mater that fuses with the arachnoid and dura mater, phylum terminale. Okay, spinal cord. You have here a big foramen, foramen magnum. Okay, where your medulla oblongata extends as your spinal cord. And then you have here your conus medullaris, tapering of your spinal cord above the L2 or second lumbar. And then you have here your phylum terminale that fuses with your arachnoid dura mater. Okay, let's talk about the spinal nerves. Paths of communication between the spinal cord and the body region. Okay, there are 31 pairs of spinal nerves that emerge from the intervertebral foramina. Remember your intervertebral foramina, so like in between means in between the vertebrae, the vertebra. Okay, so the foramina, these are different foramina that are located in between the vertebrae. So we have 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Okay, so there are structures that we call roots. Okay, these are bundles of axons connecting each spinal nerve to a segment of the cord by even smaller bundles of axons, rootlets. Okay, so ang attached talaga sa spinal cord would be your rootlets, and then they form a root. Okay, so this is your posterior root, and this is your anterior root. Okay, posterior root, anterior root. Ano yung na-learn natin in the first lecture? Okay, the back side or the posterior would correspond to your motor nerve root. Posterior sensory. Okay, sorry. Posterior sensory, anterior would be your motor. So your posterior dorsal root and rootlets contain only sensory axons. Okay? Sensory axons only. Each posterior root has a swelling, the posterior dorsal root ganglion. So this is your posterior or dorsal root ganglion, posterior nerve root. Then you have here the swelling. This is your posterior root ganglion. Remember the name ganglion is collection of cell bodies that are located outside the central nervous system. It's located at the peripheral nervous system, ganglion. Contains cell bodies of sensory neurons. It's like the ganglions are relay centers. Okay? So your posterior or dorsal, same lang yan, sensory and dorsal. Posterior root, okay, and rootlets contain only sensory, and then it has a posterior root ganglion. Okay. Then anterior or ventral root and rootlets contain only motor axons. This one, anterior motor axons lang siya. Sensory, posterior, anterior motor. How do I remember this when I was still in medical school, no? As student pa lang. It's like when you're driving a motor vehicle, no? Maganon. Motor lang siya. Anterior motor. And your back is sensitive. Okay? So, ganun lang. Posterior is sensory, anterior is motor. Okay. Spinal nerves. Now, the spinal nerves are the combination na siya ng motor and your motor and sensory nerves. So, here, posterior sensory, anterior motor, when they combine to one another, they form your spinal nerve. Okay? Posterior plus anterior equals spinal nerve. It's a branch from the spinal cord and passes laterally and exits through the intervertebral foramina. No? So, kaya siya meron tayong 31 pairs of your spinal nerves. Okay? Lalabas siyang ganyan. So, the combination of your, kasi ito isa lang to eh. Combination of your posterior plus anterior equals your spinal nerve. So, you have your 31 pairs of spinal nerves. The spinal cord is shorter than the vertebral column. Of course, the vertebral column extends from this one to here. Spinal cord only ends at the superior border of your L2. Lumbar and sacral and coccygeal regions do not leave the vertebral column at the same level they exit the cord. Their roots angle inferiorly alongside the phylum terminale. What does this mean? Okay, starting from the lumbar na, no? Kasi here, parang horizontal lang ang exit ng mga spinal nerves natin. Horizontal. However, starting from the lumbar, then also your sacral and your coccygeal regions, not at the same level na, no? Their roots angle inferiorly. Okay? Angle inferiorly so that they could course with their normal anatomical position. That's why they form like parang horse tail na dito, no? Parang horse tail na yung position ng mga spinal nerves natin. So that's what we call your cauda equina. This one here, cauda equina, corresponds to looking like a horse tail, no? Horse's tail. Extends inferiorly to end of the spinal cord and consists of roots of lumbar, sacral, and coccygeal spinal nerves. No, kasi pababa na sila. No? So they exit the L1 to L5 exit through the intervertebral foramen, while your sacral spinal nerves exit through their corresponding spinal sacral foramen, okay, located in your sacrum. Yung mga foramen natin dyan, this one, S1, S2, S3, S4. Lalabas dyan yung spinal nerves natin. Okay. The spinal cord extends from the medulla oblongata of the brain to the superior border of the second lumbar vertebra. Yeah, we've discussed about this, papuntang superior border of your L2. Okay, let's try to review collections of nervous tissue again. Clusters of neuron cell bodies. Cell bodies, we call it ganglion, like this one, when it's a cluster of cell bodies in the peripheral nervous system. However, if it's located in the brain or in the spinal cord, you call them your nucleus or nuclei, clusters of cell bodies in the central nervous system. And then how about the bundles of axons? We call it nerve, bundles of axons in the peripheral nervous system, nerves, spinal nerve. But the axons that are located in the central nervous system, we call them tracts. Now we call them tracts, the axons. Central nervous system, nucleus, tracts. Peripheral nervous system, I want you to remember nerve, ganglion. Okay? Let's proceed with the internal na anong nasa loob ng spinal cord. Okay? So a transverse section of the spinal cord reveals regions of white matter that surround an inner core of gray matter. White matter surround gray matter. The gray matter forms a letter H or a butterfly. Okay? It consists of dendrites and cell bodies of neurons, unmyelinated axons, and neuroglia, gray matter. Unmyelinated, kaya siya gray ang color. Okay? There are three horns or three regions on each side. So what are these horns? Posterior, anterior, and lateral horns, gray horns. Okay, so you have here a posterior horn, lateral horn, hindi masyado klaro, and then you have your ventral gray horn here. We have another picture later that would help us appreciate posterior, anterior, and lateral horns, gray horns. Always remember that posterior could also be referred to as your dorsal, no? Dorsal, posterior, ventral, anterior. So you could somehow interchange these terms, no? So parang adjectives lang sila. So your posterior gray horn contains sensory neurons and interneurons, sense and interneurons. The sensory neuron cell bodies located in the posterior root ganglion of a spinal nerve, no, posterior. How about the anterior? Contains somatic motor nuclei. Sensory interneurons posterior, anterior somatic motor nuclei. So your somatic motor nuclei are clusters of cell bodies of somatic motor neurons, of course, that provide nerve impulses for contraction of skeletal muscles. So I want you to remember always somatic motor skeletal muscles talaga, voluntary. You can voluntary, okay? Contraction of skeletal muscles. And then your lateral gray horns contain autonomic motor nuclei located between the anterior and posterior gray horns. Of course, lateral lang siya. Only in the thoracic and upper lumbar spinal cord segments. And of course, it contains autonomic motor nuclei, clusters of cell bodies of autonomic motor neurons that regulate the activity of cardiac muscle, smooth muscle, and glands. Autonomic, can we control? No, we cannot control. So cardiac muscle, smooth muscle, and glands. Posterior sensory and interneuron. Anterior somatic motor neuron, we can control skeletal muscles. Lateral gray horn, autonomic motor nuclei, cardiac muscle, smooth muscle, glands. We cannot control, involuntary. Okay, gray horn, gray matter, letter H or butterfly, the center spinal cord. How about the white matter na? So surrounds the gray H. Consists of white columns, myelinated axons, kaya siya white, of the neurons. So it has a posterior, anterior, and lateral white columns. No? Gray horn, white columns. Gray horn, white columns. So it contains tracts, bundles of axons, because it's located in the central nervous system, spinal cord. Okay, so we call it your tracts. So we have sensory and motor tracts. Sensory tracts are ascending tracts. Why do we call it your ascending tracts? Because they carry nerve impulses ascending to the brain. Sensory, from the sensory, they carry the information towards the brain so that the brain could interpret it, right? Sensory, ascending tracts, ascend yung impulse or the message towards the brain. As compared to your motor or descending tracts, the message or the impulse is carried descending from the brain. Pababa na siya, motor. That's why we call it your descending tracts. Sensory and motor tracts of the spinal cord are continuous with the tracts of the brain. Okay? Tracts of the brain continuous with the tracts of the spinal cord. Okay? Because it's just the same tracts. Axons located in the central nervous system. The central nervous system is composed of the brain and the spinal cord. Okay. So in this picture, the posterior gray horn contains axons of sensory neurons of cell bodies of interneurons, sensory and interneurons. Lateral gray horn, autonomic motor neurons, we cannot control. And the anterior gray horn contains cell bodies of somatic motor neurons. Anterior gray horn, we can control skeletal muscles. Okay, so let's get oriented with the picture. This is a transverse section of the lumbar spinal cord. Okay, this is anterior, this is posterior, this is your gray horn, H, this is your gray horn. This is your gray matter, letter H, surrounded by white matter, and here are your gray horns. No? Posterior gray horn, lateral gray horn, and your anterior gray horn. Other side, posterior gray horn, lateral gray horn, anterior gray horn. Okay, and you have your white columns. Okay, what are your white columns? Anterior, posterior, and your lateral white columns. Okay, white columns. Anterior, white column, lateral white column, posterior white column. Okay, so you have here structures that divide the spinal cord into right and left. No? Anterior median fissure, this one, and you have your posterior median sulcus. Okay, sulcus. So these structures divide the spinal cord into right and left side. Okay, so here you could appreciate the rootlets forming the root, anterior, no? Anterior rootlets forming your root, motor. Posterior, you have here your ganglion, and then anterior plus posterior spinal cord. Okay, posterior dorsal root ganglion, posterior plus anterior spinal nerve. Okay, okay, I hope that's clear. Okay, so you have here your gray commissure. Gray commissure corresponds to the H crossbar. Diba? Nagpo-form siya ng letter H, the crossbar. And you have here the central canal, located at your gray commissure. Your anterior white commissure, this one, joins the right side and left side of your white matter. Okay, anterior white commissure. So we have the nucleus or nuclei, kung marami. In the gray matter of the central nervous system, the brain and spinal cord, we can locate different nuclei. Nuclei are functional groups formed by clusters of neuronal cell bodies. Cluster sila, marami. We have a sensory nuclei. They receive input from receptors via the sensory neurons. So the nerve impulse, the message is being sent from the sensory receptors towards the nuclei found in the spinal cord and the brain. So from the periphery, yung message papuntang spinal cord and the brain so that the message could be interpreted, sensory nuclei. And then there would be motor nuclei. They would provide the output of effector tissue via motor neurons. Okay, via motor neurons na. They would provide the output. Ano yung gagawin mo? Magko-contract ba si muscle? Magre-release ba ng hormone? Mag-excrete ba ng enzymes, etc. Okay, so we have your sensory receiving the input, motor nuclei providing the output. So parang afferent and efferent pa rin siya. Receiving the input, sensory, giving the message kung ano yung effect na dapat niyang gagawin, motor nuclei. Okay, the posterior gray horn contains axons of sensory neurons and cell bodies of Now, we're done with this one. Same. Here, so posterior gray horn, lateral gray horn, anterior gray horn. Okay, central canal. So you have here your great commissure, the letter H. Yeah. Posterior median sulcus, anterior median fissure divides the right side and the left side of the spinal cord. Anterior white column, lateral white column, anterior white column. Gray horn, white column. Okay, so let's proceed with the spinal nerves. We have how many pairs? 31 pairs. Name according to the level of the vertebra from which they emerge. Yun nga. Yeah, you have 31 pairs. Emerge from the spinal cord through the intervertebral foramina and connect the central nervous system to the sensory receptors. Sila ang magko-connect from the central part, no? Spinal cord to your muscles, to your sensory receptors, to your glands in all parts of the body, so that the message would be continuous. Nerves attached to the spinal cord by two roots, the dorsal root and the ventral root. Yun nga, this is more specific na lang, no? Although I touched it a little a while ago. Your dorsal roots are made of axons of sensory neurons, dorsal, sensitive na, di ba, ang back, dorsal root. Dorsal root ganglion is just the swelling containing cell bodies of sensory neurons acting like relay centers of the message. And the ventral roots are composed of axons of motor neurons. Motor, action, motor. So both somatic motor and autonomic motor. What are the effects? What are the effects? Somatic, we can control skeletal muscles. Autonomic motor, we cannot control. Heart, glands, smooth muscles, intestine. Okay. So 31 pairs, left and right. Ayun. Spinal nerves. Both, when you say spinal nerves, both na siya motor and sensory. When it's just the anterior nerve root, motor, posterior, sensory lang. Okay? Ayun. So spinal nerve composition formed by two spinal nerve roots. Spinal nerve is a mixed nerve because it's already formed from dorsal root, sensory, and ventral root or anterior root, motor root. Okay, so mixed na yan siya parate. Both. Connective tissue coverings of spinal nerves. Each spinal nerve and cranial nerve consists of many individual axons and contains layers of protective connective tissue coverings. May covering din ang mga spinal nerves natin and for protection. Okay, so the individual axon is wrapped in what we call endoneurium. Okay, endoneurium, innermost layer. So the axons of group axons, we call it your fascicles, wrapped in perineurium, which is the middle layer, and the outermost layer, epineurium, it's the outermost covering. Okay. Okay, just like in your muscles. Okay, you have your endoneurium. Marami ng mga axons. We call your fascicles. Your fascicles will be covered in by your perineurium. And then sa lahat-lahat na epineurium. So this is your picture. Okay, so 3 layers of connective tissue wrappings protect your axons. Endoneurium surrounds the individual axons. Individual axon, anong nakakover niya? Endoneurium. Then, perineurium surrounds bundles of axons, which we call your fascicles. So, madami ng axon, we call it your fascicle. Ano nagko-cover sa fascicle? Perineurium. And your epineurium surrounds an entire nerve. Marami na compositions na. So, we have different fascicles, and then you have also your blood vessels, etc. So, your epineurium surround the entire nerve, just like in your muscles. So, here is an actual spinal nerve. Okay. So, you have here a blood vessel. Tapos, yun, maraming mga axons. Each axon is covered by your endoneurium. A group of axons, call it your fascicle, would be covered by your perineurium. Okay, by your perineurium. And group of your fascicles, and then which includes blood vessels na, blood vessels na. It's covered by your epineurium. Endo, peri, epi. Inner to outer. Endo, peri, epi. Excuse me. Okay, so let's proceed with the distribution of spinal nerves. Spinal nerves divide into several branches or rami. We call it your rami. Ramus, isa. Ramay, marami. After passing through your intervertebral foramina. Okay? Sige. We call it your ramus or ramay. Marami. Posterior, anterior, nagiging, so meron siyang ganglion, ang posterior. So it becomes your spinal nerve. Your spinal nerve, after passing your intervertebral foramina, will divide, will have several branches. Call it your rami. So these are your different rami. We have your posterior ramus, anterior ramus, meningeal branch, and a rami communicantes. Ano itong posterior ramus? Serves the deep muscle and skin of the posterior surface of the trunk. Okay? Deep muscle and skin of the posterior surface of the trunk. Posterior ramus. You have your anterior ramus. Serves the muscles and structures of the upper and lower limbs and the skin of the lateral and anterior surfaces of the trunk. Muscles, upper and lower limbs. Back, posterior ramus. Anterior ramus, upper and lower limbs, and lateral trunk. Meningeal branch. Now, what is this meningeal branch? Re-enters the vertebral cavity, so babalik siya. Babalik siya sa vertebral cavity through the intervertebral foramen, lalabas through the intervertebral foramen, papasok ulit ang meningeal branch ng spinal nerve to re-enter the vertebral cavity and supplies the vertebra itself, the vertebral ligaments, blood vessels of the spinal cord, and meninges. Okay? And then you have your rami communicantes, which are components of your autonomic nervous system, the sympathetic and parasympathetic systems. Okay, so let's get oriented with the picture. Posterior, anterior. This is a superior view, galing sa taas. Okay, so you can see here the spinal cord. Okay, so posterior muna tayo. Posterior ramus. Ayan. Let's start here, spinal cord. Then you have your posterior nerve rootlets, posterior root. Meron siyang ganglion, di ba? Posterior. Then you have your anterior or ventral root. When they join with one another, they form what? Spinal nerve. Spinal nerve composed of anterior, anterior motor, posterior sensory. And then your spinal nerve, after exiting through the intervertebral foramen, the foramen in between the vertebrae, no, will have divisions and branches. The posterior, anterior, meningeal branch, and you have your rami communicantes. Okay, posterior, muscles of the skin and posterior surface of the trunk. Punta siya sa likod. Na deep muscles of the back, posterior. You have your anterior, limbs na naman siya. No? Upper and lower limbs and lateral anterior surfaces of the trunk. Meningeal branch, babalik si meningeal branch. Yun, babalik si meningeal branch. Papunta sa vertebrae, arteries, spinal cord, and its meninges, the covering ng spinal cord. Okay, and then your rami communicantes will have will be part of your autonomic nervous system. So you have here sympathetic ganglion on the sympathetic trunk. Okay, so autonomic nervous system na siya. Rami communicantes. Ayun. So hopefully, mas klaro na. You have here your denticulate ligament, transverse pia mater, and the like. Okay. Woo. Okay. So that, kaya pa? Kaya pa. Okay. Distribution of the spinal nerves. Some join with branches from neighboring nerves to form plexuses. So some nerves, no, some branches form neighboring nerves. So they will join together, form plexuses. Okay, once you term it as a plexus, it's a network. No? Connections na siya. Network of axons or nerves. The nerve names relate to the region they innervate. Okay? Kung ano yung pangalan ng nerve, they correspond to the region in the body that they innervate. Spinal nerves T2 to T12 do not form plexuses. You could notice here, okay? Hindi sila nagpo-form ng network. No? Walang joining. Here you could see joining. Okay? They form plexuses. However, in T2 to T12, wala. Solo lang, solo flight. Okay? Comment down below kung sino ang mga solo flight. Okay, so yun. They do not form plexuses T2 to T12. They are called your intercostal nerves or thoracic nerves. No, intercostal or thoracic nerves. Thoracic because they course in the inferior part of your ribs, no, at your intercostal areas, no, in between the ribs. They directly connect to the structures they supply in the intercostal spaces, the spaces in between each rib, and supply the abdominal muscles, the skin of the chest and back, and the muscles between the ribs. So these are your intercostal nerves or your thoracic nerves, T2 to T12. They do not form plexuses. And we will discuss one by one the different plexuses, the different networks of the axons and nerves. Let's start with the cervical plexus. Ayun. C1 to C4 plus an additional contribution of your C5. Okay, C1 to C4 additional contribution from your C5. So C1, C2, C3, C4, C5, ayun, meron silang different network, no? Parang networking. So they have different networks that join together and eventually they will have the nerves that are named according to the structures in the body that they innervate. So the cervical plexus supplies the skin and muscles of the head and neck, no? And superior parts of the shoulders, chest, and even the diaphragm. Important nerve would be I want you to remember is your phrenic nerve that innervates your diaphragm. The diaphragm is the primary muscle that is really important for breathing, inspiration. Your diaphragm contracts. Okay, when you inhale, diaphragm, so it's located below, inferior to your ribs. No, inferior to your ribs, inferior to your the basis of your lungs. When your diaphragm contracts, bababa siya. Okay, so your lungs would be able to expand. Your diaphragm is innervated by your phrenic nerve. Phrenic nerve comes from the nerve roots C3, C4, and C5. I want you to remember the mnemonic C3, C4, C5. Keep the diaphragm alive. C3, C4, C5 keep the diaphragm alive because your phrenic nerve has contributions coming from C3, C4, and C5. Okay. So I want you to appreciate posterior, anterior, and here, the origin of your cervical plexus. Okay. So roots, nerves. Okay. Yan. Maybe we'll have different session with the discussion of the different nerves. Okay. So next would be your brachial plexus. Cervical plexus would be here. Brachial plexus would be here. Okay, formed by the roots of spinal nerves from C5 to C8 and T1. C5, C6, 7, C8, and your T1. Supplies upper limbs, some neck and shoulder muscles here. And then important nerves, radial, ulnar, and median nerve. Okay, so your brachial plexus has different compositions. Now we have your roots, the trunks. We have an anterior and posterior division. No, anterior harap, posterior division papuntang likod. Yun. And then you have your cords and you have your different branches, the different segments ng brachial plexus natin. So it's like a tree. Starts with the roots, then trunk, anterior and posterior division cords, and you have your branches. Now branches. So I will not really let you memorize this one. Ang medicine na siya. No, but I want you to remember that your brachial plexus is formed by roots from C5, 6, 7, 8, and T1. And then they have their different segments. No? Roots, trunks, the anterior and posterior division, cords, and then you have your branches. You have your radial here, no? Radial nerve, axillary, ulnar nerve, and the different nerves. Then we have here the mnemonic for subunits, no, of the brachial plexus. Risk takers don't cautiously behave. Roots, trunks, divisions, cords, and branches. Okay, let's proceed with the injuries to the brachial plexus. So what are the manifestations that we could assess during physical examination that would help us be able to identify, this nerve is injured because the patient manifests these characteristics. Okay, let's start with your herb Duchenne palsy. It's like waiter's tip, no? Parang waiter down na humingi ng tip. Okay, there's an injury to the upper nerve roots, C5 and C5, C6, because there would be loss of sensation to also to your lateral arm. And then, ganito yung position ng upper arm ng patient. This could be due to falls or the head of the humerus is natanggal from its attachment. Okay? C5, C6, herb Duchenne. Waiter's tip. Wrist drop injury to your radial and your axillary nerve, inability to extend wrist and fingers, wrist drop. Okay, radial, including your axillary nerve, wrist drop, inability to extend, nakadrop lang siya. Okay. How about if your median nerve is injured? You have your median nerve palsy. There would be numbness, tingling, and pain in the palm and fingers, inability to pronate and the forearm and flex the proximal interphalangeal joints, inability to flex the proximal interphalangeal joints of all digits. Proximal, ito, distal interphalangeal joint, distal, proximal interphalangeal joints. Proximal. Inability to pronate the forearm, hindi niya ma-pronate, and flex the proximal interphalangeal. Hindi ma-flex ang proximal. And the distal interphalangeal joints of the second and third digits. Second and third digit, no? Index and your middle finger, hindi nila ma-flex. Kaya parang ganun. Okay? Median nerves, palsy. Claw hand, ulnar nerve palsy. Inability to abduct or even adduct the fingers. Adduct, abduct, hindi nila magagawa yan. And then there would be atrophy of the interosseous muscles of the hand. Atrophy, liliit yung muscles. Okay? Hyperextension of the metacarpophalangeal joints. Metacarpophalangeal joints, this one here. Pangit ang kamay ko. Okay? Metacarpophalanges. Metacarpus phalanges. Okay? Metacarpo interphalangeal joints. Knuckles. Metacarpo interphalangeal. This would correspond to your proximal interphalangeal joints, distal interphalangeal joints. Okay. And then winging of the scapula. This is due to the injury to the long thoracic nerve that results to your serratus anterior muscle paralysis. Because your long thoracic nerve innervates your serratus anterior muscle, if there would be injury, weak na ang serratus anterior muscle mo. That's the reason why it results to like the winging of the scapula. Scapular medial border protrudes. No? Because what's the function of your serratus anterior muscle? It keeps the medial side it keeps the medial side of your scapula at the middle part, no, at the medial part, because it has insertion towards the medial border of the scapula. So kung weak siya, once you push against the wall, for example, madodominate siya ng muscles pulling the scapula laterally, no? Because your serratus muscle cannot keep the scapula at its medial portion. No. So you have here the different injuries. Herb de Sheen, wrist drop, median nerve palsy, the ulnar nerve palsy, claw hand, and winging of the scapula. Okay, let's proceed. Lumbar plexus formed by the anterior rami of spinal nerve roots L1 to L4, L1, L2, L3, L4. Supplies the anterolateral abdominal wall, the external genitalia, and the port of your lower limbs. Important nerves femoral to anterior thighs, your quads. Okay. L1, L2, L3, L4. Yun. So we have here the anterior and posterior divisions, and then the different nerves. No? Ayan. So I want to shape lumbar. L1 to L4. Sacral plexus, no? So this one is your sacral, sacral plexus. Sacral plexus formed by the anterior rami, spinal nerve roots of L4, L5, and S1 to S4. Supplies the buttocks, perineum, and most of the lower limbs. Sciatic nerve is the largest nerve in the body. Sciatic nerve. And the important nerves, gluteal sciatic, towards the posterior thigh and all of the leg and foot. So the largest nerve, sciatic nerve, this one. Composed of the common fibular nerve and the tibial nerve. Sciatic nerve, malaking malaki. We do not want to injure this nerve, so that's the reason why we do not give intramuscular injections to newborns. No, hindi sa buttocks, no? Intramuscular injections sa buttocks, sa puwetan, because of the different uh, the different nerves that are located here. We do not want to injure these nerves. Okay, that's why we intramuscular injection, maybe sa vastus lateralis, the lateral part of the thigh with the newborns. Okay. This is the lumbar plexus. This is the sacral plexus over here. Okay. The coccygeal plexus formed by the anterior rami, spinal nerve roots of S4, S5, and the coccygeal nerves. Okay, so this is the origin of the sacral and coccygeal plexus. No, sacral and coccygeal. Coccygeal plexus here, S4 and S5. Sciatic nerve, malaking malaki talaga. Okay. Common fibular tibial. Common fibular tibial. Sciatic nerve, which is part of your sacral plexus. Okay, so we proceed with the dermatomes. Ano tong dermatome? No? So it's like the dermatomes form a map in the skin ng body from head to toe. A dermatome is an area of skin that provides sensory input to the central nervous system via the posterior roots of one pair of spinal nerves or via the trigeminal nerve. Okay, trigeminal nerve sa face, and then the rest would be because of the sensory input coming from the posterior root of the spinal nerves. Okay, posterior root kasi bakit nga posterior? Sensory. Ang anterior motor yan sensory. Okay? The nerve supply in adjacent dermatomes overlap somewhat. Okay? Paminsan, nag-overlap din sila. Damaged regions of the spinal cord can be distinguished by patterns of numbness over a dermatome region. Now, for example, there would be injury to the spine and we would be able to trace kung ano yung level ng injury niya because of assessing the dermatomes. No? Ano yung areas wherein there would be numbness or there would be particularly discomfort with the maps, no? And it will help us distinguish kung anong regions na of the spinal cord is damaged. So for example, there would be a problem with your lateral forearm, no? Lateral forearm and then even your arm, no? C5, C6, may problem dyan. Well, there's loss of sensation, there is loss of sensation, numbness, tingling sensation. So it will help us be able to distinguish that there could be a problem with C5 and C6 regions in the spine. No? It helps us in the distinguishing the patterns of numbness over a dermatomal region. Paano yung damaged region ng spinal cord. Okay? So if the skin in a particular region is stimulated by the sensation is not perceived, but the sensation is not perceived, the nerves supplying the dermatome are probably damaged. No? Hindi na nila nafe-feel yung sensation. For example, for example, we stimulate the lateral forearm, for example, tapos we let the patient close his eyes. Nafe-feel niya, sir? Hindi. For example, sa paa. Nafe-feel niya to, sir? Hindi po. For example, nafe-feel. Ay, hindi. Sorry. Hindi nafe-feel until T10, for example, nafe-feel na niya. So, T11 down, hindi niya nafe-feel. So, we would be able to have an idea kung ano yung level din sa spinal cord ang affected and with the injury. Okay? And let's proceed with the brain and cranial nerves. Oh, sorry. Yun. The brain and cranial nerves. The brain and spinal cord develop from the ectodermal neural tube, no, to development. So the anterior part of the neural tube expands along with the associated neural crest tissue, and constrictions in this expanded tube soon appear, creating three regions called primary brain vesicles. So these are your three primary brain vesicles. The development ng brain to. From neural tube, the neural tube expands with the associated neural crest tissue, and it will form constrictions. So you have your three main primary brain vesicles, the constrictions. The vesicles, 3 to 4 week embryo, no? So this is your brain na. This would be your brain. We can divide it into the three primary brain vesicles: prosencephalon, mesencephalon, and your rhombencephalon. Okay? Prosencephalon is your forebrain, mesencephalon is your midbrain, and your rhombencephalon is your hindbrain. And then in the succeeding development, your prosencephalon will further develop into your telencephalon and your diencephalon. Mesencephalon pa rin. And your rhombencephalon will develop and give rise to your metencephalon and myelencephalon, which are your 5 secondary brain vesicles, no? In a 5-week embryo. No? Lima na. Telencephalon, diencephalon, mesencephalon, metencephalon, and your myelencephalon. Your telencephalon will give rise to your cerebrum and lateral ventricles. Diencephalon develop into your thalamus, hypothalamus, and epithalamus, and third ventricle. Your mesencephalon would give rise to your midbrain and aqueduct of the midbrain. Metencephalon, pons and cerebellum, and upper part of the fourth ventricle. And myelencephalon will give rise to your medulla oblongata and lower part of the fourth ventricle. No? So these are your the adult form structures that are derived from the vesicles. Okay? Bakit ganito? So because later on, you would be able to appreciate bakit ganun yung composition ng mga structures that we are talking about. No? So, like, cerebrum, these are parts of your isang area, the encephalon, no? This would comprise your brainstem, midbrain, pons, and the medulla. Cerebellum, malapit din siya at this area. Yeah. So what are the major parts of the brain? No? We have your brainstem. It's continuous with the spinal cord, and it's composed of the medulla oblongata, the pons, and the midbrain brainstem. midbrain, pons, and the medulla. Medulla, di ba? Siya na yung mag-join with your spinal cord. The diencephalon is comprised of your thalamus, hypothalamus, and your pineal gland, which is located in your epithalamus. Thalamus, hypothalamus, epithalamus, diencephalon. Okay. Your cerebrum, it's the largest part and most superior. Its surface covered with gray matter, the cortex, and deep to your cortex is the cerebral white matter. Your cerebellum, posterior and inferior, means the little brain, and your cranial meninges, you have your dura, arachnoid, and pia mater. The dura, arachnoid, and pia mater are your layers that cover and protect your brain. Okay? And for example, may dura mater tayo dito in covering the brain. It is continuous with the dura of the spinal cord. Arachnoid matter of the central of the brain is continuous with the arachnoid matter of the spinal cord. Your pia mater is continuous of the brain is continuous with the pia matter of covering the spinal cord. Okay. Ayun. So the four principal parts of the brain are the brainstem, cerebellum, the encephalon, and the cerebrum. Cerebrum, cortex. The encephalon, ano yung composition niya? Thalamus, hypothalamus, and then your thalamus. Ang pineal gland is part of your epithalamus. Thalamus, hypothalamus, epithalamus. Brainstem, midbrain, pons, medulla. This is your cerebellum. And your medulla, it would be continuous with your spinal cord. Okay, so these are the major parts of the brain. No, so I want you to appreciate this one with this one. Later on with this one. Okay, cerebrum, diencephalon, tatlo, brainstem, pons, and cerebellum, magkalapit lang din sila. Pons, cerebellum. Okay? Cerebrum is different from cerebellum. Okay? Again, cerebrum, cortex, diencephalon, thalamus, hypothalamus, epithalamus, where your pineal gland is located. Brainstem, parang stem ng brain, no? Brainstem. Midbrain, pons, medulla. Cerebellum. There's another picture. Cerebrum, the encephalon composed of your thalamus, hypothalamus, and epithalamus. Brainstem, midbrain, pons, medulla, here. The cerebellum over here. Okay, so let's discuss the brain blood flow and the blood-brain barrier, or your BBB. What is blood-brain barrier? But it's a barrier between the blood and the brain. Let's get oriented with the picture. This is capillary. No, capillary, merong red blood cell. No. So blood. And then it's covered with your astrocytes. And then you could see here tight junctions. Excuse me. So the blood supply of the brain mainly is from the internal carotid and the vertebral arteries that supply the blood towards the brain. The dural venous sinuses drain into the internal jugular veins back to the heart. So yan yung circulation ng blood natin papuntang brain and how it is drained, no, back towards the heart, so that the blood would be oxygenated again by the lungs papuntang back again, pump towards the brain. Requires 20% of the body's O2 supply. Ang brain demands or requires 20% of the body's O2 supply, oxygen supply. 4 minutes lack lang ng oxygen would result to permanent damage. This is the reason why if there is an area in the brain that is lacking with oxygenation or blood supply, we really need to be fast with in the management, how to assess kung saan yung area na most probably is not receiving proper oxygenation, because yun nga, after 4 minutes, it could really result to permanent damage. Requires continuous glucose supply. The brain wants continuous glucose supply because there is no deposition of glucose in the brain. Walang storage ng glucose. No? And the brain is protected by the blood-brain barrier that allows passage of lipid-soluble materials, oxygen, carbon dioxide, alcohol, and anesthetic agents, but controls entry of most harmful materials. Because kasi brain is really important. Kaya merong structures that protect the brain, no? Created by tight capillaries and astrocytes. Remember your astrocytes? One of your neuroglial cells, no? Yung food processes niya here would help in the protection that make up the blood-brain barrier. Okay. Yeah, so let's talk about this fluid, the CSF, cerebrospinal fluid. Saan na siya located? Subarachnoid space. The CSF is clear, colorless, liquid composed primarily of water that protects the brain and spinal cord from chemical and physical injuries. That's the reason why your CSF is located in your brain. Nasa brain siya nakaprotect siya sa spinal cord, because your subarachnoid space is also present in the brain, no? Covering the brain and your spinal cord. It carries small amounts of oxygen, glucose, and other needed chemicals from the blood to neurons and neuroglia. And your CSF continuously circulates through the cavities in the brain and spinal cord and around the brain and spinal cord in the subarachnoid space. No? So, simply put, your CSF is an important fluid that will help in somehow the oxygenation, supplying the glucose needed by the brain, continuous glucose giving, and then it's located in the central nervous system, brain, and spinal cord. Your CSF is formed in the four ventricles of the brain. Ano itong ventricles? Parang rooms, no? Parang rooms where your CFS is located. Okay? So we have here your two lateral ventricles, 1 and 2, that will be drained, no? That will flow to your third ventricle and then flow to your fourth ventricle. I just want you to remember lateral, may dalawang lateral ventricles, 1 and 2, papuntang third, papuntang fourth ventricle. Your CSF is formed in the choroid plexuses by filtration and secretion of blood plasma in specialized capillary networks covered by ependymal cells in walls of ventricles. So walls ng ventricles, the rooms where your CSF is located, it's lined with ependymal cells. No? Ependymal cells, remember ninyo, part ng neuroglia. Okay? So it's part of your choroid plexuses. No? They help in the filtration of the blood, no? By specialized capillary networks, ependymal cells, and then you would draw your cerebrospinal fluid. Ano yung pathway ng CSF natin? Through the four ventricles, may dalawang lateral, may third and fourth ventricle, apat. They would flow to your central canal of the spinal cord and within the subarachnoid space. Then, mare-reabsorb siya through the arachnoid villi into the blood in the superior sagittal sinus. So what's the function of your CSF? Aside from you're giving oxygen and nutrients, no? It cushions the brain and provides nutrients. Okay? So, ano tong ventricles na pinagsasabi mo, Doc? So these are your ventricles now. The rooms where your CSF is located. So you have your one interventricular foramen on each side that connects a lateral ventricle to the third ventricle. So this is your lateral ventricle. Ilan yung lateral ventricle natin? Dalawa. You have your interventricular foramen that will drain the CSF or flow the CSF from lateral ventricle to your third ventricle. From the third ventricle, the CSF will flow through your aqueduct of the midbrain, cerebral aqueduct, papuntang saan? Fourth ventricle. No? 1 and 2, lateral ventricle, dadaan interventricular foramen to your third ventricle, daan through your aqueduct of the midbrain or your cerebral aqueduct to your fourth ventricle, and then ventricles, no? Third, fourth ventricle. Ventricles are cavities within the brain that are filled with cerebrospinal fluid, as mentioned. Ayun. So, yeah. Lateral ventricle 1 and 2, interventricular foramen, third, cerebral aqueduct, fourth ventricle. The CSF is formed from blood plasma by ependymal cells that cover the choroid plexuses of the ventricles. So here are different ependymal cells. Okay, so you will see here ependymal cell. This is your blood capillary of choroid plexus. There would be filtration, no? Filtration. So here, details of section through a choroid plexus. So arrows indicate direction, no? The direction of filtration from blood to your CSF. May filtration of CSF. So here is a superior view of the lateral ventricle where you could see your choroid plexuses. Choroid plexuses help in the formation of your cerebrospinal fluid in your ventricles, no? Ventricles siya. Ayun, so that you would be able to appreciate it more. Sige. You have different choroid plexuses in the different ventricles, and then they help in the formation of cerebrospinal fluid as mentioned, no? May CSF. Kaya bibigay siya ng CSF, no, to your different ventricles, no? We have 4 ventricles, dalawa dito, 1, 2, 3, and 4. So your lateral ventricles, CSF will flow through your interventricular foramen to your third ventricle. Third ventricle flow through your aqueduct of the midbrain or cerebral aqueduct to your fourth ventricle. The CSF now will flow through your lateral and median apertures. So you have your 1 median foramen and 2 lateral foramina. It's the foramen of Magendie, middle, lateral foramen of Luschka. No? Magendie, middle, Luschka, lateral. Then the CSF now will flow through the subarachnoid space. Then to your arachnoid villi, where it would be drained. Now it will join the venous blood towards the heart and lungs. Then babalik sa arterial blood. And with the help of the ependymal cells, no? May filtration na namang mangyayari sa blood, no? That will help you in the filtration of CSF pabalik sa ventricles. No? So this is the cycle, no? The formation and circulation and the absorption of your cerebrospinal fluid. How about this one? Okay, let's start with the lateral ventricle. Lateral, yun, kita mo yung mga choroid plexuses found in the third ventricle, the lateral ventricle, the third ventricle, and your fourth ventricle. May filtration pa rin nangyayari dyan, no? Absorption of your, formation of your CSF. No? So let's start with your lateral ventricle to your interventricular ventricle, third ventricle, the aqueduct, no? The cerebral aqueduct, Then fourth ventricle, then you would have your lateral and lateral and median aperture, papuntang subarachnoid space, no? Because your CSF is located in the subarachnoid space. Yan, punta siya dyan. Then balik sa arachnoid villi, no? Arachnoid sinus yun siya. No? Punta siya dyan. Until such time that it will go with your venous blood, then flow back to your heart and lungs and back to your ventricles na naman through your choroid plexuses. So this is the flow of your cerebrospinal fluid. Just the frontal section of the brain and spinal cord. Again, your lateral ventricles, 1, 2. You have your interventricular foramen, third ventricle, aqueduct of the midbrain or cerebral aqueduct, fourth ventricle. Then you have your lateral and median aperture. Foramen of Luschka, foramen of Magendie. Yeah, so let's proceed with the brainstem. Brainstem pa tayo. So it's the most inferior. Your medulla oblongata of the brainstem is the most inferior part of the brainstem. The white matter connects with the spinal cord and other parts of the brain. Now, contains vital nuclei. Cardiovascular center regulates the heart rate and blood pressure. Medullary rhythmicity area adjusts respiratory rhythm. So, if you know the structure and if you know the function of that structure, once there's an abnormality with the patient, with the physical examination, you would be able to identify kung anong structures affected na may problem with the patient. So, other sensory and reflex motor areas are located also in your medulla oblongata. Cranial nerves 8, 9, 10, and 11, and 12 are attached here. Okay, so this is your pons. This is your medulla oblongata, medulla. Cranial nerves 8, 9, 10, 11, and 12 are attached here. Okay. We'll talk more about the cranial nerves in a while. Okay. How about the pons? This is the pons. It's still part of your brainstem. It connects the medulla to the medulla to the midbrain and above. Your midbrain would be here, okay, which is also part of your brainstem. Midbrain, pons, medulla. So your pons serves as a bridge, connects the medulla to the midbrain and above, contains ascending and descending tracts, okay, axons of the central nervous system, and connects the left and right areas of the cerebellum, okay, cerebellum, because your pons and the cerebellum are developed, no, in one particular structure from one particular structure. It contains nuclei. Your pons contains nuclei. Motor relays from the cerebrum to the cerebellum help control still with breathing. No? So, what have we observed so far with breathing? No? Merong parts controlled by the pons and even the medulla. So, brainstem is really important. Once there is trauma to the brainstem, no? May pumalo sa'yo dito, no? Brainstem is affected, for example, then there would really be uh, an effect with your breathing, no? So cranial nerves 5, 6, 7, and 8 are attached here. Okay? 5, 6, 7, and 8. Okay, particularly here, may 8 na, may 8 din dito. Particularly in pons, it's more of the sa vestibulocochlear nerve, it's more of the cochlear part. No? Sa medulla, it's may 8 siya, di ba? Ang part ng vestibulocochlear, because your vestibulocochlear nerve, which is your cranial nerve number 8, no, has two main branches, the vestibular part and the cochlear part. In your medulla oblongata, it's more of the cochlear part, no, hearing. while in your pons, may 8 pa rin siya, but it's more of the equilibrium and balance. No? Equilibrium and balance. Vestibular part ng vestibulocochlear nerve. Okay, so you have here the 5 trigeminal, 6 abducens, 7 and 8 nerves, cranial nerves. How about your midbrain? Your midbrain is still part of your brainstem and it connects the pons to the diencephalon. Okay, so medulla, your pons connects your medulla oblongata to your midbrain and above. Your midbrain connects the pons to the diencephalon above. And your midbrain is composed of different nuclei. Substantia nigra is related to Parkinson's disease. There's a problem with the substantia nigra. No? Substantia nigra. Red nuclei help in coordination of movements. Red nuclei. The midbrain is also the origin of the cranial nerves, oculomotor and your trochlear nerve, no? Oculomotor. And then which are nerves that help in the control of the eye movements. And you have your superior colliculi, nuclei involved in scanning eye movements, response to visual stimuli, superior colliculi. Inferior colliculi responses to auditory input. Okay, so this is your midbrain. Now, reticular formation, we'll discuss in a while. This is your cerebral peduncle. Tectum, superior colliculus. Okay, so this is your brainstem over here. This is your midbrain, pons, medulla. These are your different cranial nerves. We'll discuss the cranial nerves also. We'll touch a little bit of your cranial nerves. Midbrain, pons, medulla. So I want you to appreciate the different cranial nerves that are branching out, no? Closely associated with your brainstem. Reticular formation, this one, no? Reticular formation are net-like arrangements of gray and white matter. This contains ascending and descending tracts, and the ascending part is called your reticular activating system, your RAS. Reticular activating system, ascending part. Carry sensory pathways to your cerebral cortex and help maintain consciousness and helps induce sleep also. Okay, depending on the need. Okay, maintain consciousness and helps induce sleep. RAS. Let's proceed to your diencephalon. No? It's composed of your thalamus, hypothalamus, and your epithalamus where your pineal gland is located. Okay? As mentioned, diencephalon, thalamus, hypothalamus, pineal gland, part of your epithalamus. Thalamus is the major sensory relay center, also motor, autonomic, and consciousness function. No? Thalamus. No? Motor, autonomic function, the things that we cannot control, and consciousness function. Are we conscious or not? Thalamus. Hypothalamus lies inferior to your thalamus, kaya siya hypo, baba ng thalamus. Control of pituitary hormone production. Pituitary here, no? Pituitary and hormone production because your hypothalamus will be making and secreting hormones that regulate also certain messages, no? Certain processes in the body. Works with the autonomic nervous system, regulating many viscera or internal organs. Your hypothalamus also is involved with feelings and behavior patterns, regulation of eating, drinking, and fluid levels, control of body temperature, regulation of circadian rhythm, sleep, and waking. Madaming function ng hypothalamus. So your hypothalamus is really important. Okay. So circadian rhythm is like the sleep and waking cycle. No, when melatonin or a hormone that is induces you to sleep, saan ang melatonin increase, they decrease. No, it also has to play with the environment. Kasi When there is light, it stimulates the melatonin to be decreased in secretion. When it's dark, melatonin somehow is increased. It induces you to sleep. No, that's the circadian rhythm, body temperature, and the like, as mentioned. The pineal gland secretes melatonin, closely related to your hypothalamus, controls sleep and biological clock, and working with the hypothalamus, no, it develops the sleep-wake cycle. No, this is the diencephalon. So anterior view of the frontal section. So this is your thalamus. This is your hypothalamus. No, part of your diencephalon. Epithalamus also is part of your diencephalon. Let's proceed with your cerebellum. Again, cerebellum is not same with your cerebrum. Okay, cerebellum. Location, posterior to the medulla, and pons, inferior to your cerebrum. Attached to the brainstem by cerebellar peduncles. These are your cerebellar peduncles over here. You have superior, middle, and inferior peduncles. That attaches the cerebellum to your brainstem. Okay. Structures to cerebellar hemisphere. No. Cerebral cortex is gray matter, and it looks like having a tree-like appearance in a sagittal section of white matter and gray nuclei. Tree-like siya tingnan, no? Ang cerebellum. Gray and white matter. Gray, cerebellar cortex, labas. White matter, arbor vitae. So this is your brainstem. This is your cerebellum, midbrain, pons, medulla. Continuous na kagad siya with your spinal cord. Same here. Cerebellum, pons, medulla, spinal cord. Pineal gland, part of your epithalamus. So you have here your aqueduct of the midbrain and fourth ventricle. So what's the function of your cerebellum? Receives wide range of sensory input from muscles, joints, tendons, eyes, and inner ears. Compares actual movements with intended ones. You're conscious kung ano yung gusto mong gagawin sa hindi. The coordination of your body and what you want to do. Okay, so helps in producing smooth, coordinated movements. Helps execute skilled motor activities. Kung ano yung gagawin mo, smooth ba? No? Regulates posture and balance. No? So we test the cerebellum, especially in cases for vehicular accidents. We let the patient we test it by letting the patient follow the doctors, producing smooth, coordinated movements. No? The patient cannot do this. No? Smooth, hindi siya smooth if the patient has problem with cerebellum. Nose to finger. No? If this is the finger of the doctor, nose to finger, hindi niya magagawa yan. With the problems with the cerebellum. No? Coordinated movement. No? Magmi-miss siya. Or hindi niya makaka-touch. So this are the functions of your cerebellum. Tree-like in cross-section. Let's proceed to cerebrum. Iba na. Cerebrum na tayo. Cerebrum. Parang the brain itself sa taas. No? Cerebrum. The outer cerebral cortex, no, has an internal white matter. Gray outer, internal white matter, and it has a deep gray nuclei. No? Deep gray nuclei. Surface folds of the cerebral cortex are called your gyri. Maraming gyri. Singular, gyrus. Grooves between the gyri, in between the gyri are called your sulci. Singular, sulcus. Here in this picture, you have your gyrus. Surface folds of cerebral cortex. Folds. Parang yung bulging. No? Sulcus would be the grooves in between your gyri. Parang lines. No? Sulci, sulcus has the L, parang lines. So it's between your gyrus or gyri. Between your gyri. Sulci. Longitudinal fissures divide cerebrum into left and right hemispheres. Okay, so this is your longitudinal fissure. Longitudinal fissure divides the cerebrum into right and left sides, hemispheres. Hemispheres connected by corpus callosum. This is your corpus callosum, no? Cross section. Right and left. Right and left. Tama ba? No, Hemispheres connected by your corpus callosum. Okay. Each hemisphere has four lobes, right? And left hemisphere has four lobes. Frontal, parietal, temporal, occipital. This is the frontal lobe, parietal lobe, temporal lobe, occipital lobe. Frontal, parietal, temporal, occipital. Central sulcus separates frontal and parietal. Central sulcus in between the gyrus, di ba? Yung line, parang line na folding. So, your central sulcus, this one, separates the frontal from the parietal lobes. Precentral gyrus, the bulge, or the, yun nga, the folding, no? Anterior to the sulcus is the primary motor area. So this is your precentral gyrus over here. Motor area, primary motor area. Post-central gyrus is the primary somatosensory area. Motor, primary somatosensory area. Deep brain nuclei, basal ganglia, is composed by your globus pallidus, putamen, caudate nucleus. No? Ano pa sila? Ito sila. No? Your basal nuclei. Before, it's termed as your basal ganglia. But what's wrong here? It's correct that it is composed of different cell bodies, the basal ganglia. However, it is changed now to basal nuclei. Why? Because these networks are located in the central nervous system, and we call the networks of the cell bodies, no, groups, nerves. Sorry. Nuclei, no, nucleus, central nervous system. Ganglia for the peripheral nervous system. That's why the basal ganglia is now changed to basal nuclei na ang term, no? Made by your caudate nucleus, putamen, and globus pallidus. Globus pallidus, putamen, and caudate nucleus. Your globus pallidus and your putamen, no, is collectively termed as your lentiform nucleus. Lentiform nucleus plus your caudate nucleus, no, it's termed as your corpus triatum. Why corpus triatum? Because of the internal capsule, no, looks like striations din siya, lines, no, lines that crosses along this nuclei. This is called your corpus striatum. Okay, so the basal nuclei is composed of your caudate nucleus, putamen, and your globus pallidus. Let's proceed to your limbic system. Limbic system, ring of structures on inner border of the cerebrum and floor of the diencephalon. It's called your emotional brain. Plays primary role in pain, pleasure, anger, affection, and in behavior. Limbic system, ano yung emotion mo? Are you in love? Are you angry? Do you feel sad that your efforts were not appreciated? Or you're really happy? May pleasure ba? No? So this is entails the function of your limbic system. Involuntary activity related to survival, and it's important in memory development also. So the components of the limbic system here are shaded in green and surrounding structures. No? The limbic system governs emotional aspect of behavior. No? So these are the different structures that are part of your limbic system. Kumusta ang emotion mo? Comment down below kung sino ang love na inyong life. Ang break. Okay, let's talk about functional areas of your cerebral cortex. Your cerebral cortex has been researched, and there are different areas na corresponds to specific function. No? So specialized areas in specific regions of your cerebral cortex, functional areas. Sensory areas receive input. That's for perception. No? You know kung ano yung nakita, hawakan mo, narinig nyo. Sensory areas. Motor areas initiate the movements, motor. Ano yung effect? Associative areas, complex integration or storing of memory, ano yung emotion mo, reasoning, parang contemplation, and what's your judgment. No? So, parang pa rin siyang sensory, afferent, then interneuron, associative areas, then the motor area, the effect, efferent. Sensory areas, primary somatosensory area, located at the post-central gyrus. No? Input includes the touch, proprioception, the position, knowing the position of the body, pain, itching, tickle, and temperature. Primary visual area is located in the occipital lobe sa likod. Primary auditory area, temporal lobe. Primary gustatory area, taste base of the post-central gyrus. And primary olfactory smell area, medial aspect of the temporal lobe. So these areas are located at different areas in the cortex of the cerebrum. So for example, occipital lobe is located at the posterior part, no, nandito, primary visual area. Once there is trauma or injury, no, nabangga dito or pinalo ka dito, occipital area, occipital lobe yung hit. May problems talaga makikita with the eyes, with the vision, because the primary visual area is located in your occipital lobe. How about if there's a problem with the auditory area sa temporal lobe? Ang pag-process din ng hearing ninyo is a problem. So these sensory areas are located in specific areas in the brain. How about motor areas? No? Ano yung action natin? Ano yung movement na gustong gagawin? Located anterior to the central sulcus. So sensory areas, post-central gyrus, likod ng central sulcus. Motor areas, harap ng central sulcus. Remember this one? Central sulcus, anterior would be the primary motor area. Action. Post-central gyrus, posterior ng central sulcus, somatosensory area. No? Post-central, somatosensory area. Primary motor area, pre-central gyrus. So Broca's speech area interacts with premotor areas and primary motor area to regulate breathing and speech muscles. Speech muscles, that's why you can talk, no? You can speak. Broca's speech area. Because of the Broca's area, no? You can speak. So it's located is in the left hemisphere in 97% of persons, Broca's speech area. Okay. Motor. Motor lang siya. Action. Association areas. Adjacent to the sensory and motor areas and connected via association tracts. Integrate and interpret information. Examples would be somatosensory association area, posterior to primary somatosensory area, and integrate sensation, exact shape and texture of object compared with stored memories. Ano yung shape ng coin? Ano yung shape ng marble? Na-remember kung ganito yung shape ng, let's say, keychain ko noon. Even if you don't touch it, even if you don't see it, because of you touch it, and then the doctor is letting you feel it, okay, you are able to still identify because of the somatosensory association area. Wernicke's area, left temporal parietal lobes, located at the left temporal parietal lobes. Interpret meaning of speech, words to thoughts. You interpret what you hear, no? You interpret what you hear. Right hemisphere adds emotional content. So Wernicke's area. So usually, there would be, if there would be trauma or injury to the brain, there would be affection also with the let's say with problem with the Broca's and Wernicke's area. No? Broca's area would be in area 44-45. Ano nga yung Broca's area? Motor. You are able to speak. Broca's speech area. You are able to speak, say something. Wernicke's, no? Area. You are able to understand, no? Understand the words that you hear. Okay. So once a patient has an injury, no, in Broca's speech area, in Broca's area, the patient cannot speak. Hindi niya masabi yung gusto niya sabihin. Pero he can understand because your Wernicke's area is intact, no? Is intact. However, if there is problem with your Wernicke's area, the patient can speak, may sasabihin siya, maririnig mo siyang may sasabihin, pero you cannot understand what he is saying because the Broca's Wernicke na tayo. The Wernicke's area is not functioning well. Hindi niya na-interpret ng maayos kung ano yung gusto niyang sabihin or understands what we are telling him. Okay? Telling him to say or understands or comprehend what he or she is hearing. Okay, so there are different areas, no? Sensory, motor, and integrative signals located in the brain. No? For example, ngayon sa occipital, primary visual area. No? So, frontal lobe. Ayun. Frontal. This would be your parietal, occipital, and your temporal lobe. And we proceed with the cranial nerves. I know that there's a different video, but we'll just touch the cranial nerves. We have 12 cranial nerves, no? O to touch and feel. Very green vegetables. Olfactory, special sensory smell, olfaction. Optic, special sensory for vision. You test for visual acuity. Sensory lang din siya. Oculomotor, along with your 3, 4, and 6 oculomotor, trochlear, and your abducens. Motor, control eye movements. Trigeminal is mixed or both, sensory and motor. General sensory, touch, pain, pressure, hot, cold in face. Motor to muscles used for chewing, particularly for your third branch, mandibular branch of your trigeminal nerve. Your facial nerve is also mixed, special sensory taste for the anterior 2/3 of your tongue, taste. Motor to muscles of facial expression, ask the patient to smile, raise eyebrows, close eyes, etc. Should be symmetrical. Motor to muscles of facial expression, ears, glands, and some salivary glands. Then your 8 is your vestibulocochlear, special sensory, hearing. Glossopharyngeal is also mixed sensory for posterior of the tongue, posterior 1/3, pharynx and palate, blood pressure, and motor to pharyngeal muscles, swallowing, salivary gland, and parotid. So we could ask the patient to swallow if we want to assess also the glossopharyngeal function. Vagus mix, the major parasympathetic nerve, vagus nerve. Okay. Sensory from pharynx, ear, diaphragm, visceral organs, in thoracic and abdominal cavities. That's why it's major parasympathetic nerves. No more of abdominal cavities siya. No, rest and digest. Parasympathetic. Motor to palatal and pharyngeal muscles, swallowing and voice to viscera in thoracic and abdominal cavities. Rest and digest, parasympathetic nerve. Increase in peristalsis. You want to rest. Ang effect ng vagus nerve. Accessory, motor to voluntary muscles including sternocleidomastoid. Sternocleidomastoid, again, is the muscle connecting your sternum to your clavicle and your mastoid. And then the trapezius, move head and shoulders. Nerve number 11. Number 11. Hypoglossal motor to the tongue, swallowing, and speech. No? So for 9 and 10, and even 11, you could ask the patient to swallow, but more of the hypoglossal, stick the tongue out. It should be at the center or midline. So these are the different cranial nerves, no? As mentioned, associated with the brainstem, most, no? So here is your cranial nerve number 1, olfactory nerve. Cranial nerve number 2, there would be the chiasm here, or the crossing of the optic nerve. This is your optic tract already. This is your oculomotor nerve. 4, cochlear. This would be your 6, abducens. See here, somehow big cranial nerve. This is your trigeminal, 3 main divisions. Trigeminal nerve. So 5, 6, this is your facial. This would be your cranial nerve number 8, 9, vestibulocochlear, 9, vagus. Then this would be your accessory nerve, and then your hypoglossal nerve. No? Parang arrange lang din siya ang numbering actually. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so these are your cranial nerves. Cranial, midbrain, pons, medulla. That's your number 2. Closely, the chiasm of your cranial nerve number 2 is closely associated with the pituitary stalk hypophysis. No, pituitary gland. Your 3, walang 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay, that would be all. Thank you for kind attention. Laban lang, and thank you for finishing the video. Ayos.